We've been reporting this morning there is a tsunami of need in social care and a staffing emergency, which the CQC says means it is not working for staff or those they care for. Worrying stuff. Gillian Keegan is the Care Minister and is live with us. Morning.
Good morning.
Would you agree with those words that the Care Quality Commission used there, that the system is not working?
Oh, I think there's been issues with the workforce in the system for quite a long time. But I just want to say, it's my first time as Care Minister on your show, so I just want to say a massive thank you to the 1.5 million people who do work in care, social workers, social care across the country, because we don't say thank you to them nearly enough. But it is the biggest workforce, one of the biggest workforces in the country. And it also has growing demand all the time as our demographics change, as we age. So it always has challenges because it's big, it has a lot of churn, and it grows every year. And of course, the challenges this year are even more acute because we've got 1.1 million vacancies and there's huge competition for labour. And that's why we have announced, this package of 162.5 million to help just between now and March in the short term to get extra capacity and retain capacity in the system.
But if there's 1.5 million people working in care in England, as you say, and there's 10% of them not there who should be, that's the current vacancy rate according to the CQC, is 162 million actually going to go very far at all?
Well, yes, we have done this before, and what it did last time is it first of all helped retain people. They have massive retention issues, and in fact that's the number one thing that we're trying to do to make sure that we retain people in the sector. But it also helped with agency works, and there was thousands of new recruits to the sector as well. So yes, that does help. But again, as I say, we've got lots of competition for labour, and one of the reasons we're really focused on reforming social care is because we know this workforce isn't valued enough, it isn't professionalised. We've got a lot of work to do to help it become more stable, because with those amounts of churn plus a high rate of 0 hours contracts, it isn't it does need to be developed and professionalised. So it is a challenge, but in the short term all we can do is get extra capacity, which is what I
take your point on reform, but as we were just hearing from somebody who works in the care sector a little bit earlier in the programme, they're not paid enough. They're paid less than supermarket workers. Is that right? Can you professionalise the service when they're paid not much beyond the living wage, most of them?
Well, I mean, obviously the living wage has gone up quite a bit since we introduced that in 2015. But, basically, these are private companies, right? They have to pay what they have to pay to be able to get staff and professionalised staff. But it's beyond that. It's not just, pay is important as well. But also, I'm very worried about the high level of 0 hours contracts. There's a lot of insecurity in the system. There's a lot of churn in the system. There's a lot of re-recruitment. There's a lot of retraining. None of that makes any sense. So we have to fix those things as well, because that's going to have a bigger impact on stability, in my view. And of course, as you professionalise and stop, that sort of aspect of retraining and recruiting all the time, then that actually does have a big stabilising impact. And hopefully will also make sure that we can progress careers and pay people fairly.
This has been an issue for many years, as you say, but also that there is a symptom of recent times as well, in terms of the pandemic, in terms of the fallout of us leaving the EU. The CQC point out that vacancy rates went from 6% in April to 10% in September this year. Are you open to, like the government has with butchers, like the government has with HGV drivers, putting some kind of visa fix in place so people from abroad can more easily come and fill the gap?
Well, I think we've been quite clear that's definitely not our preferred option. We do have some visas in place for senior social care.
But what about the essential workers, which the CQC points out there's such a vacancy with?
Well, we've said quite clearly, what we're trying to do as a country is make sure we invest in our own people, we train our own people, we look after our own people, we pay our own people well. And what companies, of course, always want you to do is to find what looks like an easy option. I actually don't think it would be an easy option, because all over the world, people are faced with challenges in labour in social care all over the world, because obviously we've had a massive disruption to our labour market everywhere. So I don't think, first of all, it's not what we want to do, but secondly, I don't think it would be successful either.
Elsewhere, GPs might be on strike, we learn overnight, over plans to name and shame those who don't do enough face-to-face appointments, to name those who earn over 150k, and of course plans to have them oversee medical exemptions for people who can't get vaccinated, which they say would be too much work. How are you going to try and avoid this?
Well, I mean, first of all, our GPs have done a fantastic job and continue to as they roll out the booster programme across the country. What we've done is try to obviously get more access to GP appointments, and that's why there was a package announced earlier in the week, £250 million, to give them more money to employ extra staff and improve services basically to patients, because there's been, a lot of disruption during the pandemic.
But they don't like that, and they're going to strike as a result. So what are you going to do?
No, they seem to have got the impression that there's going to be some league table or something. There is absolutely no plan for a league table. There's 44,000 GPs in this country. It would be impossible to even do what I think is being discussed. So no, we very much value them with extra money. £250 million has been announced in the last couple of weeks to help, and of course, we want to support our GPs, but we do need to make sure that we improve access to the services for patients, which is something that there's very much a demand for.
Just very finally, as a minister, you're a busy person. You're not 95, though, are you? The Queen, we learned, spent a night in hospital. Should the Queen at 95 be taking it a bit easier? Should her schedule be a little bit lighter, in your opinion?
Oh, well, I'm sure nobody could tell the Queen what to do. I mean, obviously we're all concerned to hear that, but absolutely delighted that she seems to be on the mend. But, she's an absolutely phenomenal, remarkable woman, and I don't think we'll see anything like her likes again. And yeah, she's just so fantastic, and I just hope that she's feeling better today. But no, it certainly wouldn't be for that. I wouldn't have the nerve to tell her what to do.
Good to talk to you this morning. Thanks for your time. That's Gillian Keegan, the Care Minister.